The next thing we're going to talk about is evaluation of the ear, hearing, and balance. Most people don't realize, but balance or equilibrium is another sense. We have the ability to understand our position by the inner ear. So first thing, someone comes in the office complaining about having trouble hearing or complaints of dizziness. You're going to get a complete health history and a complete symptoms. Objective data, you're going to observe behaviors. Is the patient only hearing on one side, not understanding what you're saying? Make sure you ask nice, clear questions. What do you think? Some behaviors that might indicate that there's some hearing loss. I'm sure you have had patients or even family members that have some trouble hearing. How does the patient typically communicate? If this person can't hear at all, then does he use sign language, he or she use sign language, or another form of communication? Do they have hearing aids, or they have had trauma or surgery to their ears? Inspection and palpation, of course, follow. Otoscopic examination. First, you're going to inspect the external canal. The outside of the ear you're going to inspect, and then as you put the otoscope together, you're going to do the external canal and the tympanic membrane. Normal canal feels smooth, empty, and minimal wax. Excessive wax or cerumen can obstruct the view of the tympanic membrane. This also could be a cause of hearing loss or impaired hearing. Normal tympanic membrane is intact. It looks pearly gray and transmits light. Notice how the speculum of the otoscope is in the ear canal. There are different sizes of speculum based on age of your patient. Otoscope examination continued. The otoscope, it's an instrument to look into the ear. The speculum piece is a cone-shaped viewing piece of the otoscope, and you're going to use the largest size possible for your patients. Some examiners feel the need to dim the room. This is not always necessary. Patient should be in a sitting up position, and you're going to pull the ear up and back for adults, down and back for kids. Slowly insert the otoscope into the ear canal while looking through the viewer. The tympanic membrane, as mentioned before, should be intact, pearly gray, translucent, and shiny. You should be able to see a cone of light and the malleus, one of the inner ear bones. This is an example of the normal tympanic membrane. You'll notice the short malleus process is on the side where the nose is. You'll see the nice cone of light. Abnormal findings: any perforations, bulging, retraction, blue, red, or amber coloring, or dullness. You'll notice the normal tympanic membrane on the left side, and you'll see one that is bright red, and you'll see pus that's behind. You'll notice how the tympanic membrane is no longer translucent. It has white pus in the background. Right? This is otitis media with some purulent drainage. Data collection. So hearing. Some of you may have experienced it yourselves or seen this done on one of your patients. There's a whisper test, the Rene test, Weber test. These three tests are for auditory acuity. For our equilibrium and our balance, the tests are the Romberg's test, Unterberger test, and Dix-Hallpike test. The Rene test is using a tuning fork, and you're going to begin. You're going to make the tuning fork work. You're going to hit it place it on the back behind the ear as you see in the picture. And once you do not feel the vibration, you're going to pick it up and the tuning fork is going to go to the ear. This instrument produces the same sound in the same range as human speech. This is used for conductive or sensorineural hearing loss. Conductive hearing loss involves interference in the transmission of sound waves to the inner ear. Sensorineural hearing loss is a result of a nerve impairment. For the Weber test, you're striking the tuning fork and placing it on the middle of the patient's skull. The person with normal hearing perceives the sound equally on both sides. If they hear the sound more on one side, there is hearing loss on the opposite side. If you've ever had a neurological exam, you might recognize the Romberg's test. The patient stands with their feet slightly apart and their arms straight out in front of them, palms up. Eyes are closed. There should be no swaying or movement back and forth. If a patient loses their balance, this could indicate a lesion or something very serious going on in the brain. It is also used to test for vertigo. A patient who has vertigo may have some slight swaying and can lose their balance. There's different forms of this test, so if someone needs to have it modified because of their vertigo or for their impairment, the doctor will do that. The Unterberger test is another test to look for balance. You'll notice this is done for vertigo and for any other neurological or possible neurological impairment. This is a patient that holds their arms out, they walk in place, and they close their eyes. They would be swaying back and forth if there is something wrong. The Dix-Hallpike test is a diagnostic procedure some physical therapists use to help relieve vertigo. This test actually elicits the vertigo's response. So you'll notice that they are sitting upward and they go back very quickly and slightly turning their head to the side they have the vertigo on. If a patient has vertigo on both sides, they might do it once to the left and then once to the right. This actually can elicit a nystagmus response in the eyes. Other tests, the audiometric testing, tympanometry, caloric test, and among others. Of course, if there's exudate, you're going to want to get a culture. Therapeutic measures, of course, are medications, anti-infectives if there's an ear infection, anti-inflammatories, there's corticosteroids that you can place in the ear for inflammation. Antihistamines can help with pressure in the ear and draining fluid, decongestants. They help expectorate drainage in the ear, just like it would expectorate nasal sinuses and from your lungs if you had some mucus in your lungs. Sticky stuff that's in your ears would come out of your eustachian tube and help drain the fluid in your ears. There's of course cerumolytics, the cerumolytics. These are for softening cerumen and helping to remove it. Diuretics. Other therapeutic measures, we have ear health maintenance, especially with our geriatric population and our children population. Chronic ear infection can cause damage to the tympanic membrane, which can cause some hearing loss. So we want to monitor those ears. We also monitor those ears to make sure there's no foreign bodies inside them and that cerumen is draining appropriately. Our older adults may need some Debrox or drops to help remove that wax. Typically, you should not be sticking Q-tips in your ears. This actually pushes the rumen back towards the tympanic membrane and can cause some damage. It can also cause irritation to your external canal. Earwax is important to help reduce microbes to get in your ear and help lubricate the tympanic membrane. Making sure part of therapeutic measures are making sure devices like hearing aids are working appropriately, and educating our patients how to care for them. Appropriate diet, and hearing your dogs as needed.